everybody. Today we will speak about hip osteoarthritis. Definition. It is a degenerative disease caused by biomechanical and biochemical forces that break the balance between between the synthesis and catabolism of cartilage, resulting in cartilage destruction. Matrix metalloproteinases (OA.mp4), which is a family of enzymes synthesized by synovial membrane that contributes to both normal and pathological tissue remodeling, play an important role in this. Prevalence. Arthritis prevalence is from 32.9 million American adults, which is about 23% of the adult population. Reported being told by a physician they have some type of arthritis. Furthermore, the hip osteoarthritis prevalence in 1999, almost 12 million American adults, approximately 10 million American adults in the study reported having been diagnosed with osteoarthritis. Hip osteoarthritis can be divided to primary osteoarthritis and secondary osteoarthritis. Primary, which is idiopathic. The primary osteoarthritis risk factors include aging, ethnicity, genetic predisposition, chromosome 12, excessive joint loading, physical activity, which can be based also on the occupation, prolonged lifting, very heavy loads, nutrition, obesity, smoking, trauma, injury. What about the secondary osteoarthritis causes? These include 1. Bone and joint dysplasia, which we will explain furthermore in this lecture, systemic metabolic disease, inflammatory causes, traumatic events, crystal deposition diseases, endocrine diseases, other systemic diseases. Secondary osteoarthritis causes, number 1, which is the developmental dysplasia of the hip, is a congenital disease in which the acetabulum has insufficient development and the proximal femur has excessive anteversion plus the coxa valga. Insufficient coverage of the femoral head, which will lead to resulting with an increased weight and surface unit, degenerative changes. The second one, which is a vascular necrosis of the femoral head, which can be idiopathic or due to steroid or alcohol induced. It results in a decreased head mechanical resistance, leading to head collapse, joint incongruity, which finally leads to a progressive degenerative process. Other systemic metabolic diseases include hemochromatosis, Wilson disease, ochronosis, Gaucher disease, hemoglobinopathy such as sickle cell disease and thalassemia, and other joint hypermobility diseases. What about the inflammatory causes of secondary osteoarthritis? These include rheumatoid arthritis and septic arthritis. As for the traumatic events, hip dislocation and fractures of acetabulum, malunion with joint incongruity. Malunion after acetabulum fracture is one of the traumatic events. Let's speak about the crystal deposition diseases which lead to secondary osteoarthritis. 1. Calcium pyrophosphate deposition disease. 2. Appetite crystal deposition disease. 3. Gouty arthroplasty. Endocrine diseases include acromegaly, hypothyroidism, and hyperparathyroidism. Other systemic diseases leading to this secondary osteoarthritis include neuropathy, arthropathy, Charcot joints, Paget's disease of the bone, and 3. Osteopetrosis. Pathology. All articular structures are affected in the osteoarthritis. Let's start with cartilage, which is the earliest and most severe modifications. Initially, the gloss decrease, yellow, opaque, rugged, develops to a progressive wearing. Lately, a complete destruction of the subchondral bone remains uncovered. So after the complete destruction, the subchondral bone remains uncovered, leading to joint space narrowing. Thank you for watching and looking forward to see you in the next video.